We currently have 5 units that are still on outbreak, and I will say that some of them are very close to coming off outbreak status, but I don't want to get ahead of myself.
COVID-19's foothold on Foothills Hospital may be waning despite 2 new infections being reported Thursday. The early investigation into the outbreak shows that the cases may not all be linked.
The preliminary conclusion we've reached is that we don't think there is a single source that explains all of the outbreaks we're seeing.
5 units at Foothills Hospital remain on outbreak status and 3 on watch. Dr. Peter Jamieson says there are some links between units, but not all.
We believe that there are linkages between the outbreaks that we've had on our cardiac units. We have 2 medical cardiology units and 1 cardiac intensive care unit where we have had COVID activity, and we think that those are linked. Linkages between the other units are still being investigated as potentials.
After no new cases yesterday, Foothills is reporting 2 new positive tests for coronavirus today, 1 in a patient and 1 in a healthcare worker, bringing the total to 80 people having contracted the virus and 11 deaths. Still, about 75% of more than 300 employees who were in isolation are now back on the job. Jamieson says the outbreak is a reflection of what's happening right across the province, community transmission. Today, the province reporting 244 new COVID-19 cases. There are over 2,700 active cases in the province, 788 in the Calgary zone, nearly 1,500 in the Edmonton zone. Hospitalizations are up by 1 person to 101, with 16 people in intensive care. The entire city of Calgary is very close to being put on watch, which means there are 50 or more cases per 1,000 people. Rocky View County and the city of Chestermere are both currently under watch status. In Calgary, Tara Overholt, City News.